You're listening to The Voice of Russia in London with me, Juliet Spare. The war on drugs debates on whether to decriminalise or reclassify certain drugs and the effect they have on society is rarely out of the headlines across the world. A recent report from the Global Commission on Drug Policy said the global war on drugs is driving the HIV pandemic. The report condemned the drug war and suggested major reforms to the global drug prohibition regime to help stop the spread of HIV infections. It also called for a greater emphasis on public health approaches to drug use, decriminalisation and experiments in legal regulation. Joining me to discuss decriminalisation and reclassification of drugs and the effects policy changes have on society is Damon Barrett, Deputy Director at Harm Reduction International and Director International Centre on Human Rights and Drugs Policy, economist Baroness Meacher and Chair of the East London and City Mental Health Trust, Niamh Eastwood, who's the Executive Director of Release, a national centre of expertise on drugs and drug laws, and on the telephone from Wales, Mohammed Dualeh, a Somalian youth worker. A recent report in the UK suggests the decriminalisation of drug possession does not lead to an increase in drug use. Niamh, you're the director of the Release, who reviewed 21 countries and came with that conclusion.
Well, I think firstly it's helpful for us to define exactly what decriminalisation is. So decriminalisation is the application of non-criminal sanctions to drug possession offences and in some cases cultivation of cannabis for personal use. Essentially, it means that those who are caught by the police in possession of drugs are either given a civil response similar to a parking fine or actually no action is taken. So we looked at, as you said, 21 countries around the world. These were disparate countries from Mexico to Armenia to Estonia, Germany, Spain, Portugal. And what we found was that in every country, there was no statistical significant increase of drug use. So it's very clear that the law enforcement model that is adopted does not have any impact on levels of prevalence within a country. And interestingly, if we look at those countries that take a harsh response to drug use, like the USA, they take a very tough criminal justice approach, and they have one of the highest rates of drug use in the world.
Can I just supplement that a little bit? Niamh absolutely rightly defined decriminalisation, what it means. Another piece of that, though, is ideally that people, rather than nothing being done, are referred for treatment. And I think this is the great strength of the Portuguese model that a lot of people have talked about, because certainly if you're caught in Portugal with some drugs on you, not only are you not referred to the criminal justice system, but you are referred to a tribunal who will decide whether you're addicted or not. If you're not addicted, then you're just given a little warning. Don't let us find you again within the next 6 months. This is a stupid thing to do, and that seems a completely appropriate response. If you are addicted, then you are referred for treatment. And this is not a soft option at all, actually, because if you don't go for that treatment, then you will get a civil penalty for breach of contract. The important thing there is that there is that nudge to go and get the treatment, use it, get better. You know, none of us want to condone drug addiction. I mean, it's a horrible thing for the individual, horrible for communities. It's bad altogether. So I think that nudge is good, actually. But also what a breach of contract fine does is to avoid somebody being criminalised. We do not want young people criminalised when it is completely counterproductive to do that.
This is a rather pertinent issue, obviously almost a year on from last summer's disorders in the UK, where a lot of stop and search techniques used by police are not very effective in terms of actually helping the youngsters on the streets. They were criminalised after the riots very, very quickly.
That's right. And the important point here is what's going on for these young people? What's going on in the schools? Is there any support for kids who are clearly in trouble, perhaps some behaviour problems and so on, to build their confidence and resilience? Because if you build the confidence and resilience of young kids, they're not going to get into these territories of crime and drugs and so forth.
Damon Barrett.
While we're talking about definitions and what we're actually talking about here, I think when we talk about that criminal laws haven't necessarily reduced drug use or decriminalisation in the place where it's happened hasn't increased it, I come from a harm reduction perspective, and we have to ask whether, although it's become the main concern, whether drug use itself is a thing that we should be concerned about and making policy for, and certainly coming to the attention of the government, or is it drug-related harms, such as deaths from overdose, such as comorbidities with mental health, such as HIV and other bloodborne viruses. These seem to be the things where we should be targeting responses, and it's something that law enforcement and the criminal law is singularly incapable of doing.
Niamh.
And just to support what Damon's saying, one of the drug-related harms is the criminalisation of people who use drugs. And as well as the kind of health consequences and the human rights consequences, we have to be realistic about this. It's only a certain group of people who are policed around this issue. We have disproportionate policing of drug offences, both in the UK and in other countries like the US. So, for example, in the UK, in 2010, there were 250,000 stop and searches in London for drug possession offences. That's half of all reasonable suspicion searches. And 8% of those only 8% resulted in arrest. The reality is that research has shown that those who come from the black community are much more likely to be policed around this. So you're 6 times more likely to be arrested for a drugs offence, you're 9 times more likely to be stopped and searched, and 11 times more likely to go to prison for a drugs offence. And that's despite the fact that drug use amongst the black community is not higher than it is amongst the white community.
But obviously we come back to the point that you made, and we will come to you, Mohammed, very, very soon, because I know you work within a community in Butetown in Cardiff, but we're coming back to the criminalisation of drug use again. Baroness.
Yes, I think that's the essence of the problem, really. The assumption is drugs, what is the response? It's about criminalising. It's a Home Office responsibility. It shouldn't be. Possibly there should be a special department answerable to the Prime Minister. Should be certainly taken away from the Home Office to get a completely different culture and environment around drug policy. But what I was going to go on to say is that we've talked about drugs as though they're sort of one and the same thing. We've got alcohol, we've got ecstasy, we've got tobacco, we've got cocaine, and so on. They are all individual drugs. As we know, a couple of them are perfectly legal at the moment, or probably always will be. But the key point I wanted to make is that those of us who want a more liberal approach to drugs, in my view, you disagree with me if you wish, really want to think about these drugs as individual substances. You cannot talk about crack, cocaine and cannabis in the same breath and think that you should have the same policy response. Heroin, for example, Switzerland have done a fantastic job in showing that you can have an active treatment program which is cost effective, which gets people back into work. A third of people, very, very disorganised heroin addicts, within 18 months are back at work. Another third are leading perfectly legal lives and so on. And it's cost effective. For every Swiss franc they spend on this, 2 francs are saved for the taxpayer. It could be rolled out across the world. Now, that's a very specific response on heroin. I wouldn't recommend the same thing at all for cannabis.
You're listening to The Voice of Russia in London with me, Juliet Spare. Joining me to discuss decriminalisation of drugs is economist Baroness Molly Meacher, Niamh Eastwood, who's the Executive Director of Release, the National Centre for Expertise on Drugs Laws, and on the telephone from Wales, Mohammed Dualeh, a Somali youth worker, and Damon Barrett, Deputy Director at Harm Reduction International and Director International Centre on Human Rights and Drugs Policy.
Criminalising any of them. Criminalising alcohol now wouldn't do any good. Criminalising tobacco right now wouldn't do any good. And whether it's police chasing down amphetamine users in Southeast Asia and people experiencing abuse because of that, or heroin users in Russia, or cannabis users in Kenya, people are being criminalised unnecessarily, and people are being driven into the criminal justice system unnecessarily. People are being driven to more harmful forms of drug use unnecessarily. So while the regulatory model for what you might want to do afterwards will be different depending on the relevant drugs, one thing we can say that joins them all up is that criminalising them is unhelpful.
I just want to bring in Mohammed at this point, though, because I think he does work within the community, and I want to see what you think, Mohammed, because in your expertise, we're talking about Khat, a legal high in the UK.
They honestly talk about a lot of, and definitions and really very interesting points in relation to decriminalisation and criminalisation of drugs. But in my experience, working with the BME communities as well as the wider communities in Butetown area of Cardiff, and if drugs were to decriminalize, and now the people would not go to jail or anything like that, or they will have access to it. And I can tell you there will be epidemic use of drugs in the areas that actually we work. And I know that this whole issue of the decriminalization might not increase the use of the drugs in relation to the countries that one of our colleagues mentioned, like Portugal and others. But in the area that actually we work, honestly, if we later on probably will have a time to discuss about the Khat and the use of Khat, which is you can buy like you buy your pint of milk from the shop. You can buy literally like that in our shop, our local area. But these drugs, going back to the drugs, if the drugs were not to be decriminalized, then I can guarantee you this will be is a big mistake, and it will be epidemic use of a lot of young people. And it's also, somebody mentioned the point of the police always stop and search, especially the people from the PME communities, to search if they got drugs on them. I was searched, and I've never used it, and I even haven't seen most of the drugs with my own naked eyes. And I will ask, are you on alcohol? I've never drank alcohol. I will be stopped and searched, and I have to go along with and cooperate with the police to do their job. And I will ask a simple question, why do you stop me? And they will go into, we were reported in a lot of use of these and selling drugs and so on and so forth. So if this issue now, the government decriminalized the drugs in the UK, we are up for a serious problem.
Mohammed, could you just give me an example, though, of what effect Khat is having on the community you work with in Butte Town?
Oh, it's having it's having a huge impact on all levels of the society, especially in our community. And a lot of young men, they're not going to school, especially year 11, year 10, 11, and 12, because that's when they started experiencing the material. Those guys who are under 20s and over 20s, they're not going to work. Even those who actually work, who are in employment, they're finding really, really difficult to keep their punctuality on track, because of when they chew for 14, 15 hours the night before that, they drank so much overnight, and they can't go to the next day to work.
Mohammed, you can't be with us in this studio, but I've got a few raised hands who want to interject now, and a few facials telling me that they probably disagree with some of what you're saying. Baroness Meacher.
I suppose I would say these young people have clearly got some problems. I would say family problems, social problems, deprivation. Maybe at school they didn't learn to read and write by the time they got to 11, so when they were 11, 12, 13, they couldn't make any kind of sense of school. We've got to start looking at our young black communities completely differently. We've got to look at deprivation. We've got to have proper, sensible policies that intervene, as I said right at the beginning, actually, in terms of improving kids' literacy, numeracy, and resiliency. That's the way to deal with these things. People don't get hooked on something like Khat unless they've got some, I would say, quite serious social problems. So we're just looking the wrong way, in my view.
I tend to agree with you that, honestly, and the way I probably go about explaining how Khat is affecting the community, there's no question now, because of the economical difficulties that everybody is facing. There is the economical issues as well as the social issues. But bear in mind, I work for Somali Youth Association. I'm one of the senior managers, and one of my projects is to help and educate and well inform these young people about the misuse of substances, i.e. Khat. And is Khat, regardless of what we do, because it's legally available in this country, you can literally buy as you buy your pint of milk from the shop.
Thanks, Mohammed. Niamh, Mohammed's got a point there, though. He's almost fighting a losing battle with his community that he's working with, almost at the coalface of what's going on. And the government here has legalised Khat. He's not going to win this one.
Well, technically, the government hasn't legalised Khat. They just haven't done anything in respect of Khat. But coming back to Mohammed's point about decriminalisation would lead to increase of use, as I said, the report that we launched yesterday shows that that's not the case. It's as simple as that. And I would ask Mohammed, does he want to criminalise these 10, 11, 12-year-olds who are using Khat? That doesn't seem to be a proper response to me, a responsible response. I know what he's saying in terms that it's other countries outside the UK that have adopted these models. But as I said before, these are countries from all over the world, who have similar experiences to us. So, for example, in Australia, a number of states have decriminalised cannabis. And there's really good research that compares the experience of an individual who's been criminalised in one state against someone who has not been criminalised. And those who were criminalised suffered negative consequences in terms of accommodation, unemployment and relationships, and they were more likely to enter the criminal justice system. And just on one final point about the policing, I mean, we have to look at how this type of policing is impacting on our communities. The police are there to protect the whole community, not certain sections of the community. And what we have is a group of young people who are disenfranchised from this experience. It is impossible for the police to do their job properly because young people do not trust in them. These groups of young people are unable to bring their complaints, their concerns within their community to them.
You're listening to The Voice of Russia in London with me, Juliet Spare. Joining me to discuss decriminalisation of drugs is Damon Barrett, Deputy Director at Harm Reduction International and Director International Centre on Human Rights and Drugs Policy. Niamh Eastwood, the Executive Director of Release and National Centre of Expertise on Drugs and Drug Laws. And Mohammed Dualeh, a Somali youth worker from Wales. Also joining us in the studio is Baroness Molly Meacher.
I think none of us around the table are suggesting that cocaine, heroin should be available anywhere. We are not talking about legalisation of certain things here. There are some drugs, for example, ecstasy, that has short-term, minor consequences. There may be great merit, maybe, in legalising ecstasy in terms of it being then safer than what we've got at the moment. That's a particular drug.
I think
but we're not suggesting
some important points in bringing in things like access to education and things like the broader situation. I think yourself, in terms of funding, cuts to the policing. There's something the United Nations, the drugs agency in the United Nations, calls policy displacement. We're putting so much effort on law enforcement, unevaluated law enforcement around the world, that what we've done is diverted well-needed funds away from things like social welfare and health, which is where we can make a hell of a lot more inroads in terms of reducing initiation. On the issue of drug use, on the issue of education itself, studies are very clear. If you want to improve outcomes in terms of initiation of drug use and reducing early teen pregnancies, unwanted pregnancies, what you do is you build an ethos of trust in the school. You build an ethos where students are willing to talk about these issues. When you put criminal blinders on, it blocks that kind of thing. What you end up doing is random school drug testing. What you end up is sniffer dogs in the schools, and you destroy that kind of relationship, and you are, again, counterproductive to what you've been trying to do.
So which country would you say has an effective model that can almost lead as example?
See, there's not any single one. It depends on what you're looking to do. You know, if you look at, I think, the best study on the Portuguese model, which was done by Caitlin Hughes and Alex Stevens, one from Australia, one from here in the UK. There's ups and downs. Overall, quite positive, but ups and downs. There's things that need to change. You still have to change police culture, for example, because when we spoke, my organisation, to drug-using communities in Portugal, they were still quite afraid of the police. They were still afraid that they'd be hauled down to the police station, and that's not helpful either. Police still might be left with arrest quotas that they might have to fill. There's any number of things you have to put in place around this. You can't just do it carelessly, so there's no single country to point to.
No, that's right.
Baroness Meacher.
Can I say, if you think about cannabis supply, I think Spain have a good model. They have cannabis growing organisations. The people who organise those organisations complain that the government hasn't got proper regulation in place to manage these organisations. But as a model, I think, for cannabis, they've got a lot to be said for that. And Spain, Switzerland, I think, really has got something to teach the world about heroin. And you can move around and say different countries have experimented with different policies, I think, to great effect, and we just all need to learn from their experience and their evidence.
So if we learn from different countries with their different attitude towards the different drugs in their differing classes, then are you saying or suggesting we need to have almost bespoke classification and policy of whether each individual drug is decriminalised or reclassified or in fact made legal? Niamh?
I think one thing we can say is that the current policy of criminalisation is an absolute disaster. We've had 40 years of it in this country, longer arguably. And this week, Ken Clarke, Minister for Justice, admitted it was a disaster. Didn't offer any policy options, but did criticise the current approach. I think, the panel is absolutely right. There are things that we can learn from other countries. One of the problems we've had is with the current approach, we haven't been able to build the evidence. We haven't been able to look at the alternatives. What we do know is the significant harms that come with criminalisation that was picked up by the Global Commission's report this week. One interesting model, we do know decriminalisation, for example. We've got lots of evidence around that. So I think that's something we can move forward to quite quickly. In terms of regulation, Molly has already mentioned ecstasy, but cannabis, for example, in the Netherlands, in terms of young people's drug use, they are unlikely to move on to harder drugs in the Netherlands. And one theory for this is what's called the supply gateway theory, whereby they are not being exposed to a kind of market of a range of illicit substances because they can legally buy cannabis. There's problems with the whole model, but they can legally buy it for their own consumption. So there's positive experiences that we can learn from.
Mohammed, having listened to the panel, would you in any way change your mind on what you think?
I honestly, it's a lot of interesting points were made through the discussion, the previous discussion. But one thing that hasn't been mentioned, Khat is not is a UK problem. Khat is a problem for a number of communities within UK, and that's why the government, they're not too fast about doing too much research on it and the harm and the reduction and whether to take whether actually to ban it for like the other countries in Europe and also the US and follow their suit. But because it's a community, especially the BME community problem, now in our city, not only the Somali community is consuming, but the Yemeni, which also has a history. Now there are a number of like the Pakistani community, never have been in history. They actually started their young people chewing Khat because of their Somali colleagues and the Yemenis. And now it's becoming an issue, especially in our area. And now a lot of people actually want to do something about it.
The report by the Global Commission suggested experiments in legal regulation. Is this a crude experiment happening in the UK?
I think it possibly is. Can I just say that we must get to this point? We need to look at the whole drug policy issue in the UK and indeed internationally. We need a review of our Misuse of Drugs Act of 1971. Clearly such a review would have a look at Khat as well. Perfectly fair point. Should it be completely legally available in your local sweet shop or not? So we need all these drugs looked at very carefully. Although it's been difficult to get the evidence because of all these drugs are illegal under the system, we now have countries that have been brave and built up evidence. And I think in this country it is urgent now, 50 years on from our Misuse of Drugs Act, that we review that act and take Khat and everything else into account.
Yeah, but you have the experts now. I had exactly another discussion with the BBC, and there was one expert. Actually, he's on the advisory board for the UK government, and he was making like each in Khat was like having 3 espresso coffee. That was his, and this guy was an expert, and actually he's a psychiatrist by profession. However, when we see the reality on the ground, it does not match his argument. Maybe I don't know what kind of experiments he was analyzing when he was come to that conclusion. Khat is the killer in our community and all the other communities. And honestly, the government at the end of this year, I think so they will come to the conclusion whether to actually ban it from the UK when they look at the taxpayers, the expense, or the actual how much money they make when they tax in the material itself to come into the UK.
The problem is already here, though, if it's already been readily made available, if they are as severe as you suggest, Mohammed. Damon?
Well, I think Khat's actually an interesting discussion to have here because it's a reverse of what we're talking about. It's a drug that's entirely unregulated. It's not produced really in any way. It's in its raw form. And the question here is that people are identifying genuine problems in their communities. I mean, genuinely held concerns, like Mohammed's saying, from his day-to-day work. And the thing is that people are left with what they see as two possible opportunities. The situation with Khat, where it's completely uncontrolled and out there, or the situation where things are criminalised and you have a law enforcement approach. And the reason that happens is because it's the only thing that really gets discussed on the international stage. And governments hide behind this so that they have a collective denial about the need for an open debate about this. The same debate about Khat and whether it should be brought within control frameworks, that being a criminal justice framework, is being had at the United Nations. And the reason it's been going on for so long is because governments know full well that it won't do any good. Now, the question I would ask Mohammed, and I think this is a really good question, is looking at the problems that you see in your community, two things. If you had the money, what would you like to do? And the second one is, would it be helpful for more police involvement in your community?
Absolutely, absolutely. But the one thing that, honestly, that I would like to address before we finish this wonderful discussion, is that if the UK government bans the Khat to be brought in this country, trust me, a lot of people will be saved from going really downhill very fast. And many other communities also will be saved. As far as the police is concerned, yes, now we started having a very effective working relationship with the police at the youth level, which is unheard of, because we're trying to build a relationship which actually the trust was an issue. And if as a police officer now reach a black youth, there's this stereotyping and all this. We're trying to bridge the gap between the police in our local level and also our youth. So then there will be a healthy relationship, working relationship between the two. And as far as the money is concerned, there's a lot. We need education. There should be a really serious awareness of, because a lot of people are not aware of the harm Khat does to the individual.
Thank you, Mohammed. Niamh.
Mohammed's highlighted that either people have problems with Khat or they're very young when they're using Khat. So what we're talking about are children or people with health problems. And at Release, we deliver services. Every week we see hundreds of people who have problematic drug use, and they are criminalised for their drug use. This isn't a response that works. That's been evident. It causes huge amounts of harm. It stigmatizes individuals. It pushes them away from treatment. There is evidence on this. In Russia, for example, there is, of injecting drug users in Russia, 37% have HIV. Criminalisation simply doesn't work. It causes greater harms to the individual and to communities.
Same question that Damon asked Mohammed almost, is if you had the money, what would you do?
I certainly wouldn't put it into police. I'd put it into school-based programs, resiliency, support, and frankly, we'd have a lot more money if we decriminalised, if we developed, I'd put it into treatment, really good treatment for people who do run into trouble. If we did that, frankly, our communities would be very, very much more healthy.
A final word from you, Damon, please.
Oddly enough, my final words on the police. There's a really positive role for the police to play if they're freed themselves from the ridiculously wasteful need to go out and police low-level drug offences.
I'd like to thank all my guests: Damon Barrett, Deputy Director at Harm Reduction International, economist Baroness Meacher, Niamh Eastwood, the Executive Director of Release, and Mohammed Dualeh, a Somalian youth worker. You're listening to The Voice of Russia in London. The headlines are next.